peripheral resistance in our blood vessels?
Diameter.
Here, the diameter of the blood vessel,
Distance.
the length of the blood vessel, and viscosity or the thickness of the blood itself. So we have those three factors to a lesser degree for these that affect airflow. The most important, same as it was with blood pressure, is the diameter of the airway. All right? So remember we had cartilage that kept our airway patent? So what's the first airway that doesn't demonstrate cartilage? The bronchial. All right? So the arterial in our vascular system was the most significant in changing or affecting blood pressure. One, because there were so many of them, and two, because of the amount of smooth muscle that was still present. So we have arteries, but arteries have a larger diameter. They can't constrict quite as much. And same with bronchi, not only are they a larger diameter, they've got cartilage, and that affects the degree to which they can constrict. So bronchioles, and it helps you because it rhymes with arterial, at least at the end. This is the major airway, which affects airflow resistance. What was the component of the autonomic nervous system that affected blood vessel diameter? Sympathetic or parasympathetic? Sympathetic. An increase in sympathetic causes constriction of blood vessels, and a decrease in sympathetic causes a dilation of blood vessels. With our airways, we use both. All right? So, sympathetic, beta 2 receptors are going to cause a dilation of the airway, and parasympathetic, muscarinic receptors will cause a constriction. What's the nerve that's carrying these parasympathetic fibers?
Vagus.
The vagus, good. And we don't name the nerves that are going to the lungs. Okay? So if someone has asthma and they're taking an inhaler, all right, it is an agonist or a sympathomimetic. It will often bind to the sympathetic receptors. And here's where the uniqueness of having beta 1 in the heart and beta 2 in the lungs. So if we use the same type of chemicals that would bind to beta 1 receptors, your heart rate would really race. Now, it still does. My son had an inhaler. He doesn't really use it now. When he was around 8, 9, 10, he hated to run. To get his heart rate up for soccer practice, my husband would get him to take the inhaler about an hour before soccer practice. So not only would his airways be opened up, but his heart rate would be up as well. Not as much as if the inhalant medication bound to beta 1 receptors, which is what we have in the SA note. So different receptors, so we don't see as strong an effect on the heart rate as well as we do on the lung tissue.
What kind of receptor? The parasympathetic?
Muscarinic?
Oh, that's an M.
The M, yeah.
Oh.
So salbutamol, other types of chemicals that are in inhalers function by causing the same effect as norepinephrine and relaxing smooth muscle. Yes?
So what makes you like all
Jittery? The same. I mean, there is an overlap. So it will bind to some, but not as tightly as it would if it was actually triggered to have the match the beta 1. When you have asthmas, well, there's actually more than just the vasoconstriction. There's also an increased mucus production, and that also is going to decrease the diameter. Okay, so it's a twofold effect between the diameter and the mucus. Okay, length of airway. Now most of us, even if you gain weight, you're not going to increase the length of your airway like we do when we increase the amount of blood vessels that we have. Okay? And you're not going to cut out a lung just to decrease the length of the airway. However, there are conditions such as using a ventilator tube, which is going to increase the airway, and that usually comes with a pump. So the person doesn't have to breathe air through all of that. But when I was growing up in the Philippines, 65 to 71, so Vietnam War was in full exposure and activity. And I would read stories about soldiers that were escaping, going underwater in the river, and using hollow reeds to breathe. So not only are you decreasing the diameter by breathing through a hollow straw, you're increasing the length of your airway by adding the addition to that. And all you have to do is just take a drinking straw and lie in the bathtub underwater and try to breathe through that. Okay? Well, you don't have to go underwater, just try to breathe through a straw. And you start to feel panicky because you're not getting the exposure, the volume of the air. And in fact, when my father-in-law, remember I said he had a trach tube put in to prevent the aspiration, and my husband commented several times that although that kept the aspiration pneumonia, it gave him this panicky feeling because just the placement of the tube in the airway and the surrounding cuff decreased the diameter of the air that he was able to breathe in with each breath, and gave him that panicky feeling like he couldn't just draw a full breath because it took more effort to do so. So again, viscosity of the air, again, that's not much of a factor. Certainly pollution, the dust particles and the pollutants are going to not only make it thicker, but displace actual oxygen. So it's going to decrease the overall proportion of the air you breathe that is oxygen. But that doesn't happen very common. This is a picture of China. Most of you are aware there was a big problem with air pollution around the time of the Olympics. And right now they're having at least a couple of weeks ago, they're actually selling air purifiers that do entire houses, and the wealthy families will put a tint over their entire house and yard, and for about $10,000 can buy a system that purifies so the kids could go outside and play in the backyard.
Outside, inside the table.
Well, yeah, exactly.
Jimmy in the bubble.
Outside the house, under the tent. But you can kind of see the smog in that view. All right, so airway resistance, and then we have lung compliance. Compliance and elasticity are related, but two different components. Compliance has to do with ease of expansion, ease of stretching. So if I take this rubber band, and let's say these are pretty thin ones. So if I take 5 of these rubber bands, all right, and try to stretch them, increase the diameter with 2 fingers, that's much more difficult to do than if I had just one. It takes a greater force to expand that. So that's talking about compliance. Okay, the higher the compliance, the easier it is to expand the airways with the same pressure. So you'll notice on this graph, we're seeing a normal compliance, so it takes a lot of pressure at first when the airway volume is small, and then it starts to level off after we get to a larger volume. Pulmonary fibrosis has a very low compliance. It's much more difficult to expand the alveoli. There's a lot of extra connective tissue and collagen fibers, a breakdown of the elastic fibers that are around the alveoli, and so it takes a greater force to lower the pressure and pull air in. Emphysema has a very high compliance. It's a lot easier to pull air, to allow the atmospheric pressure to push air into the lungs. And that has to do with the breakdown of the alveolar walls. All right, so the air spaces are larger to begin with, and we're not opening up small airways. Unfortunately, we lose the surface area for gas exchange. Okay. So compliance is the distensibility, the ease with which something can be expanded. High compliance, easily expanded. Low compliance, very difficult to expand. It's kind of like trying to blow up those balloons you make the animal sculptures with. Those really long, skinny ones. Those can be really hard to blow up until they're opened up a bit, and then it becomes easier. That's compliance. All right, when we look at elasticity, That's the reverse. So how easy is it for it to collapse? So with the rubber band, I can stretch it out, and if I let go and it just came back a little bit, it wouldn't have much elasticity. If it comes back all the way to the pre-stretch, then it has a high elasticity. All right? So compliance is the ease of inspiration. Elasticity has to do with expiration, the recoil of the airways and the return to normal size. Now, surface tension affects compliance and elasticity. Surface tension is going to make it difficult to expand and more likely to recoil. And this is the surface tension within the alveoli themselves, not in the visceral, between visceral and parietal pleura. Okay? So the smaller the alveolus, the greater the force it requires for that volume to be expanded than if it was already large. And there's more surface area for volume in that small alveoli. So the smaller alveoli tend to collapse. And remember we talked about surfactant being secreted by the alveolar type 2 cells or the septal tissue. All right, so when you're inhaling, or we're doing the compliance aspect.
So why do they shrink back faster or don't stretch as much? Because they have less cells?
Under what
in their body?
condition?
Well, you were talking about
So the
how
smaller alveoli?
The smaller
Yeah.
one.
Okay, so they have, typically, the smaller alveoli are going to have more surface area to the volume. And so as we're changing volume, we have to increase the volume proportion to surface area more than if they were already large and we were stretching them like that. And surface tension just increases that. So surfactant is most effective on the smaller alveoli. We see a greater effect on the smaller alveoli than we do on the larger alveoli. And it's that lipid material that's coating the surface. So surfactant promotes alveolar stability and prevents the small alveoli from collapsing as they're attracted, the walls are attracted to each other via that surface tension. So many of the slides that I'm showing now are on the new lecture PowerPoints that I put up Friday. So I left the old ones up there, but at the end of each of the sets it says, they'll say 2013 I think, PowerPoints, and so this information is up there. I know you already printed yours off, but at least the information is there.
It says 2013.
Do I have it? The area up there. Well, it's right under. There's a new set for pulmonary ventilation. There's a new set for anatomy. I didn't delete the other ones, so it should say 2013 or 13, spring 13 or something like that. All right, so let's stop here and take about a 10-minute break, and then we'll come back, and I have about